you have felt a little under the weather or felt like something was off with your body. So you logged on to one of those websites and found you had either nothing wrong with you or one of the most rare diseases in the world and possibly 5 minutes to live, right? Okay, we've all seen that. Well, now you can have useful, accurate information through a simple click. And here to tell us more, please welcome back Dr. Tarek Fahl from DocResponse.
Thank you.
All right.
Thank you.
So just talk a little bit about your background. First of all, orthopedic surgeon, highly advanced and educated in medicine, selected as one of America's top surgeons for 2009. You've cared for the Rockets, the Astros. Have you ever seen J.J. Watt?
I have not.
We'll leave that aside right now. But as you know, so many times things happen, and our dilemma is: do we go to the hospital, or is it something we just put ice on, or something we take care of for ourselves? So tell us what DocResponse is.
Sure. DocResponse is a software diagnostic tool developed by board-certified specialists in order to, number one, educate users to be better informed about their disease process to make better decisions, and number two, to assist healthcare providers as a clinical decision support tool.
So it's kind of like almost like a door before the door.
Right. It's really educate patients to make better decisions. And when they're better educated, they make better decisions, reduce unnecessary ER and doctor office visits, as we were talking about.
Because we certainly know one of the crises in this country is that you show up in the ER and you can be there for hours.
That's right.
And then even if you're there first, how many of you have been to that situation, right? You can be there first, but the most critical things will be taken ahead of you, and so that makes it pretty tough.
Right.
But this way, at least you have some information to go by. Okay, it is outperforming worldwide leaders WebMD and the Mayo Clinic.
That's correct.
And the reason why is what?
Our diagnostic algorithm on the back end. I think the way we put our algorithm together, it's proprietary, but we were able to provide the best and most accurate diagnostic tool on the market, as well as singling and choosing specific clinical physicians to help with us.
Okay, all right. So you also assist primary care doctors in decreasing the risk of misdiagnosis.
That's exactly right. The study by the Institute of Medicine this past month found that 5% of primary care doctors misdiagnose patients in the clinic setting. So that 5% can be a big problem for wasted costs in health care, putting the physicians in a situation of liability. But DocResponse has been shown to provide what's called a differential diagnosis list, or the most likely problems that the user may have, to reduce the rate of misdiagnosis. And that's what we provide.
And here's the great part here is I think sometimes we assume a doctor is a doctor is a doctor. Well, your primary care is kind of the front line to basically say if you should move on or we can take care of it here.
That's exactly right.
But there are times when a specialist is needed, and that sounds like what you're saying here is that that specialist can go ahead and oversee something like this, if there's a question.
But what we've done is we've gathered subspecialists together to produce this product. So this will really be, or at least very useful to these primary care physicians to get knowledge of specialists to help them make better decisions, because you can't expect primary care physicians to know every specialty.
Right.
Me as an orthopedic surgeon, I don't know things about pediatrics any longer. Learned about it many years ago, but that's not my area of expertise. So to provide primary care doctors with this knowledge of subspecialists, it gives them a better chance to make a better decision of how to treat that patient, and maybe reduce specialist referrals when they're unnecessary.
Yeah, well, and for us, it kind of recreates that doctor's office visit that you're talking about.
Exactly right.
All right, DocResponse. Okay, you also have a follow-up with the doctor, or how do you...
Right, so at the end of an assessment, you'll get a list of the most likely to least likely diagnosis that the user may have. We also have content to read about each, developed by our board-certified specialists. So if you need to read about, say, a rotator cuff tear, all that content is there in it. And then it also gives recommendations to try over-the-counter, which are conservative measures when appropriate, follow up with a doctor, or ER when appropriate as well. Yeah. So we give guidance as well.
Yeah, it's perfect, because you can take care of an issue by going up and buying over-the-counter medications, which also saves you money a lot of times. Okay, 45% of the users say they saved a trip to the ER thanks to this app. That's almost half of those people saved that trip to the ER. That's amazing. It's funny, it says that women are the biggest users of DocResponse. That's because we will check and see if something's really wrong, right? And men are like, I'll tough it out. I'll be okay. I'll go ahead and play that Texans game with a broken hand. Anyway, all right, so DocResponse. So we can just log on, DocResponse.com?
That's right. We have an app, DocResponse app, as well as DocResponse.com. It's a website that's free to use to help users get, make better decisions in regards to their health. But also, I see it as a tool developed by specialists that gives you knowledge of specialists at the touch of a button.
Yeah, absolutely. All right, to learn more on DocResponse, just log on to DocResponse.com. And if you'd like to get in touch with the doctors themselves, you can send an email to thedoc@DocResponse.com if you have further questions. Thank you very much.
Thank you.